I am the chair of the Rhode Island EERMC. I am also the Chief Executive Officer of Youth Build Preparatory Academy in Providence, Rhode Island. In my role on the council, I represent the income eligible participants who we all know are underserved when we discuss energy efficiency. For those of you who are not familiar with the EERMC, the EERMC was established in 2006 to oversee the procurement of energy efficiency in Rhode Island and to make sure all Rhode Island energy customers get the maximum benefits from energy efficiency programs. Our council consists of 15 governor-appointed members representing small and large business, homeowners and renters, nonprofit organizations, municipalities, the environment, energy codes and design, and energy regulation and law. The council offers this public forum each year to engage a wide variety of stakeholders in meaningful conversation on current issues facing efficiency in Rhode Island. This year's forum is especially timely and cross-cutting as it addresses the impacts of COVID-19 on energy efficiency. And that involves much broader conversations around equity and justice, health, workforce, and the economy. So we're lucky to have a diverse panel of speakers today to help us take a closer look at these challenges, and opportunities. Before we get started, I'd like to share today's forum, the agenda for today's forum. In a moment, I will introduce Riley Loveland, who will deliver our keynote address, Building Health for All, from Portland, Oregon. Riley will be followed by two panel discussions moderated by Yasmin Jacoby from the Rhode Island Office of Energy Resources and Roberta Fagans from the Rhode Island Energy Marketers Association. All three sessions will be followed by Q&A. Karen Varengia from Clear Result will share information about how to engage with the Rhode Island EERMC before we adjourn this afternoon. And just a couple of housekeeping items for today. All attendees are muted. If you have a question for the speakers, please enter it in the Q&A box. Thank you in advance for completing the brief survey and the follow-up email you'll receive. To view a recording of today's session, visit the University of Rhode Island Cooperative Extension YouTube channel. Now I'd like to introduce our keynote speaker, Riley Loveland, a project manager from the New Buildings Institute in Portland, Oregon. Riley's focus is on energy efficiency in schools. This work includes developing educational opportunities and resources for a better understanding of zero net energy. Riley supports the project management team on various projects, including Prop 39, Zero Net Energy, School Retrofit in California, as well as other K-12 school-related work. Prior to joining NBI, she worked for the Integrated Design Lab in Washington Green Schools, doing research and energy analysis, developing and maintaining databases, as well as designing energy-focused curriculum for K-12 schools. Please join me in welcoming Riley Loveland. Thank you.
Thank you so much for having me. I really got to shorten that bio. It's really nice to meet all of you. Good morning from the other coast in Portland, Oregon, which I suppose is actually good afternoon to you all. And before we begin, I really want to encourage everyone to just take a really deep breath, relax your shoulders down from your ears. We have a lot that we're all carrying right now. And so just take a moment to yourself. Thank you, Kate, Kaylin, and everyone else for having me today. I'm really excited to be here. If you want to advance to the next slide. Thank you. So for those of you who are not as familiar with New Buildings Institute, we're a national nonprofit that works to reduce energy and carbon emissions in both new and existing buildings. Sometimes we joke it's the Old Buildings Institute. We have several really specific program areas that define our work, including building innovation, zero energy and carbon leadership, and codes and policy. Next. So I want to frame this conversation for you. This is why I had you all take a deep breath, because we are in unprecedented times. Dramatic historic events are playing out as we speak, but with crisis comes opportunity. We don't have this crystal ball to see into the future, but we do have an opportunity to understand our biggest issues now and how they relate to the buildings, and then we can cast a positive vision of the future. Next. So we're amidst what we've been referring to as a triple crisis. Next. COVID, for example, has changed how we interact with people, how we interact with our buildings. The UN recently released a statement actually saying that COVID-19 is undoing decades of environmental progress. There's also been a widely reported increase in deforestation and habitat destruction during COVID, which can only continue to contribute to animal-borne disease transmission and to human and climate change. And in this photo here, you can see that our climate is showing dramatically that it needs help. I actually heard this coined the other day as a climatastrophe. Next, please. Wildfires have ravaged the West Coast, including my beautiful home state of Oregon. The photo on the right here, I actually took 2 weeks ago as we were frantically evacuating livestock just 10 miles from my home in very urban Portland. Next, please. Not a single 2020 emissions target has been met according to the United Nations. So if our 1.5 degree target is slipping out of reach, I mean, dramatically slipping out of reach. So if emissions fail to drop, then we have used up our carbon budget within 8 years. That is so soon. That is incredibly within our lifetimes. So to hit that 1.5 degree target, we would essentially need to fall off an emissions cliff and fall by 15% a year every year starting in 2020 until we hit zero. This would be a massive coordinated undertaking. Massive is the key word here. If you want to go to the next. Students around the world are rallying. They're begging us to make a change to save their future. Anthony mentioned that I work in schools a lot. So we're down on the floor talking to these students and listening to what they need. Next slide, please. And our third crisis, which is building health for all, is accessibility and equity. All of these crises, the health, wellness, environmental air quality, disproportionately impact people of color. COVID has created a deeper chasm between those that have access to basic needs and those that don't. And people of color are more exposed to pollution, hotter temperatures, and have less access to health services and energy efficiency opportunities. Next, please. And all of these crises combine, they affect our economy and our jobs. These crises are related and they're essentially nested within each other, and they have concentric circles of impact. So if we have this shared understanding, we can move forward on policies, programs, and engagement. If we understand what our issues are, we can start to understand what the opportunities are. Next. You could actually probably go to. So what are we going to do? First off, we need to address energy and carbon in buildings. We need to focus on efficiency, which is our least cost resource, renewable energy, integrating grid and storage, building electrification, which is essentially decarbonization, and addressing the embodied carbon in buildings. We call these the 5 foundations of zero carbon policies at NBI. And if we focus on improving commercial, residential, and public building conditions, the other benefits will surely follow. Buildings should have minimum efficiency standards and be invested in as part of our public infrastructure. Next. We'll actually go through these pretty quick. So investing in our buildings creates jobs, more so than, as you can see here, the fossil fuel sector. Next. Investing in our buildings and grid creates additional economic opportunity. For every dollar invested, we get $2.40 in economic benefits. Next. Investing in our buildings and grid also creates a more resilient and adaptable society. The key there is adaptation. that can survive and quickly recover during these extreme weather events and other events such as COVID. Next, please. Oh, you might need to just hit this a few times. I forgot this was an animation. Today, there are almost 700. This number has actually gone up since I made this slide. Zero energy and zero carbon verified and emerging buildings across North America. NBI actually has a webinar right after this one to release the newest number and status update. So I'll put that in the chat in case anyone is interested. So this is really not a new concept to upgrade and connect our buildings. This is happening and this is real, it's tangible, and you can go see one in your local area. Next, please. Sorry, one more, maybe two more. So our building process absolutely needs to be prioritizing health and wellness. That is the key to this entire conversation today, focusing on indoor air quality, decarbonization, avoidance of things like volatile organic compounds, and again, really focusing on those deep energy efficiency retrofits. Next, please. For example, critical issues, this is from RMI. They just released a paper not that long ago about gas stoves and indoor air quality, because critical issues like indoor gas exposure and other indoor air quality issues are detrimental to health, especially in developing bodies. Next, please. Inadequate ventilation is a common problem among buildings, but can really be a key solution to actually mitigating things like diseases, those indoor air pollutants I just showed, and contributing to occupant wellness. So honestly, thinking about our recent indoor air issues we had from smoke in Portland, I don't know if some of you saw, but we had an air quality of between 700 and 800. I've never seen it above 100. So our systems not only need to be able to pull outside air in, but also recirculate air safely and in a filtered way. You know, I had never thought about this in my home until 2 weeks ago, because in Oregon, you generally don't need a tight envelope or super efficient HVAC because it's so mild. But with our climate changing and health issues, now it's time to react and adapt my own home, your home, and all of the buildings. Next, please. And here's the crux of it all. How do we do all of this equitably? As a design community, we need to completely reevaluate the systems in place. We need to analyze who benefits from these systems, who gets things like utility incentives, who can actually upgrade their homes, like I want to do to mine. But in order to revamp these systems, we need to engage with the communities affected. We need to be participating in their processes instead of in our process. A lot of times we get really stuck in our own process as designers. If I was in person, I would probably make you repeat their process instead of our process. So as you're sitting at home, say it out loud, their process instead of our process. Communities have their own priorities, providing for families, getting to work every day. So they may not even be thinking about the benefits or a need for energy efficiency or why it's important or even how to tap in. So talking to them, listening to what they need, then working to create systems that provide access so they benefit from the energy savings and healthier homes and ultimately have more productivity in their daily lives. This work needs to come from them, not us. We're here to support those needs and listen. Next, please. So here's kind of a quick 5-point plan, I would call it. It's access their needs, talk to them, establish a community-led process, plan and create your process for tracking success and decision-making, and ensure an ongoing funding process. That is key, and I know that's probably the hardest part, but that will lead to improved outcomes. Next, please. So here's my crystal ball, looking and visioning the future that we need now. And once all of these solutions overlap, we have our toolkit for sustainable, equitable, and healthy development. Next, please. So quickly, I want to mention something that we at NBI have been working on for quite some time. We have really found that the best way to get people on board with the path to equitable, healthy decarbonization is creating a roadmap. And with a roadmap, you do things like define your goals, develop metrics, and set a plan and a path to over time decarbonize your entire building stock. We call this getting to zero over time, so that you're strategically thinking and utilizing every trigger point in a building life cycle to continually upgrade. That's that opportunity piece. this is honestly a much longer conversation about how roadmaps are developed and what they can do and how you need to set one up. So you can absolutely email me and chat with me offline about it. But I did want to lay out here some of the key elements to include if you're thinking about developing a roadmap for your state, city, or even school district. Next, please. NBI is actually working with NYSERDA and a couple of other groups, states, and cities on developing, and a group of 60 school districts in the state of California on developing their carbon neutral building roadmaps and their roadmaps to zero over time. And in the process of doing this work with NYSERDA, we did an extensive literature review of all the roadmaps across the globe that we could find. This was zero energy roadmap, zero carbon, all of the above. So if you're looking at the road mapping process, these are some key roadmaps to review. There are more, there are a ton more, and I can tell you a little bit more about why each of these are so unique, but I highly recommend checking them out. Next, please. So I close with this. We have never had more evidence or opportunity to reinvent our buildings and our processes than we do right now. Buildings represent our values and support our livelihood in our society. This to me is what a successful future looks like in our environment if our resources were used to invest in energy efficiency, equity, and health in buildings. One more slide. We create our own destiny, and this is up to us. Our culture and our society depends on this. And that's it for me. Thank you.
Thank you so much, Riley. That was great. Folks, if you have any questions, you can click the three dots at the bottom of your screen and pull up the Q&A and type a question in there for Riley. She will be with us for about 20 minutes or so, and I can direct questions to her. So we'll wait a moment to see if any questions come in, and otherwise we will keep the program going with our first panel. I would love to welcome Yasmin Yacobi, who will moderate this session. Yasmin joins us from the Rhode Island Office of Energy Resources and is a Govern for America Fellow this year working with OER, and we are very grateful to have her. She will introduce our panelists, who we are bringing up right now.
Excellent. Good afternoon, everybody. Thanks so much for being here. And thank you, Tony and Riley, for that great introduction to the conversation today. As Kate mentioned, my name is Yasmin Yacobi. I take she, her pronouns, and I am the Energy Justice Program Manager at the Rhode Island Office of Energy. This panel will specifically be looking at the intersection of energy, race, wealth, and health. As Riley started to mention, the COVID-19 pandemic has definitely shone a light on so many of the social determinants of health and in today's society, including race, wealth, education, and physical environment. These inequities disproportionately harm frontline communities, communities of color, and historically marginalized communities, and have caused worsened impacts of COVID-19. Equitable energy efficiency programs can help in addressing some of these issues. So this conversation will hopefully put into context the relationship between energy efficiency, wealth, race, and health. We have a really fantastic panel lined up for today. First up, we'll have Angie Nkoma, who is the Executive Vice President of United Way of Rhode Island. Next, we'll have Ellen Tone, who is a principal at Tone Energy Strategy in Massachusetts. And last but not least, we'll have Kevin Kennedy, who is an Environmental Health Program Director at Children's Mercy Kansas City in Missouri. Just as a reminder to our panelists, you will have 5 minutes to speak. Everybody will go, and then we'll jump into questions. So audience, if you have questions, definitely drop them into the Q&A. And without further ado, Angie, the floor is yours.
Good afternoon, everyone. Thank you for having me here. Thank you, Yasmin. Talking a little bit today about energy and race and how I see that work in our work, how I see that impacting our work at United Way of Rhode Island. And we all know one of the areas I'm going to talk a little bit about is how we have a tremendous opportunity that we work with at United Way. We have a 2-on-1 call center that receives nearly 200,000 calls every year. And what we see is how the laws and policies and systems impact our community members through the calls that the needs that they call us for. We know that racial segregation impacts all areas of our health, and that the system is really is built the way it's intended to, and we see those deep flaws in some of the needs that our members of the community need. So housing inequalities particularly impact our urban core. We know that on average, African Americans pay higher share of their income for energy needs. We also see through our data that we have higher frequencies and of disconnections and amongst African Americans and Latinos. And we also know that 2/3 of the energy burden of Latino households is 2/3 of the Latino households is based upon energy burdens. Next, I'm going to talk a little bit about the opportunity gaps. One of the things I'd like to talk about is how our community in Oneyville is zip code 02907. And we talk about the needs that people use, the resources that people need to survive every single day. There is a wonderful opportunity atlas that I've used to kind of really compare our neighborhood, which is where One United Way of Rhode Island is located in, to other communities. And so our community, which is zip code is 02907, compared to one of the higher income communities, 02908, the poverty rate is 29% compared to 3% in Barrington. The job growth rate in Oneyville is negative 4.5% compared to 4.8% in Barrington. The median household income of residents in Oneyville is 42% compared to $42,000 compared to $96,000 in Barrington. And the median rent, interestingly enough, despite the fact that Oneyville residents at median income is $42,000, the median rent is $1,000 in Oneyville compared to $96,000 median income for residents in Barrington, and the median rent being $1,400. What we know from that data is that zip code can determine a child's future. One of the areas that I'm incredibly proud to lead at United Way is our 201 call center, and I'd love to share a little bit more about it for those who don't know about it. We have an information referral center. We are one of 247 information referral centers across the country, which means if you need help, you've probably heard it throughout the time, throughout the COVID pandemic. If you need help, call 201. And we are open 24 hours a day, 365 days a year. We have call specialists who speak 200 languages, access through a call line, and we have a number of languages online as well too. And oftentimes when people call us, the primary need is rental assistance, but the second need for the second highest need is utility assistance. Last year, we received 56,000 calls for utility assistance. And I always say that calling 211 is like the layers of an onion. You call and you say you have an issue with utility assistance, but oftentimes there are other needs. There's a housing need, there's a food need, and also there's health needs. And oftentimes these burdens, the utility burden, is impacting all other areas of the residents' life. One of the things that we've seen, like the previous panelists spoke about, is how COVID has really exposed the deep fractures in our society, and the death rates among Black and Latino communities is higher than all rates. And in the past 6 months, we've taken a total of 120,000 calls, 125,000 calls. Comparison, last year we took 180,000 calls. So in 6 months, we've increased our call volume by 58%. Again, most of those needs are for housing and energy assistance. And so it's really noteworthy that how race, where you live, where you're spending your money impacts all outcomes. And I'm really looking forward to continue the conversation and talking a little bit about how the data in terms of we need. One of the things that we do manage at United Way Rhode Island is a Good Neighbor Energy Fund. And so we get a number of calls every single year about people with the utility who require utility assistance because they can't afford to pay their rent, and because they're juggling multiple things. The majority of those calls come from urban areas where the housing stock is often older and doesn't have the weatherization needed as well too. And so I wrap up my talk about my comments by saying, look forward to continue to talk a little bit about how intrinsically in Rhode Island we're really seeing how energy efficiency is impacting every single area of the person's life, whether it be health, housing, and education. Thank you.
Thank you so much, Angie, for that and for the important work that you're doing. Next up, we have Ellen. Take it away. Thank you.
Great. Thanks, Yasmin. Are you guys advancing slides? Because I'm not seeing anything advance on my screen. Are other people seeing that? You are, huh? Interesting. Okay. There we go. Good. So I'm going to try and make two main points to pick up where Yasmin left off. And I know Kevin, we've worked together a bunch. Kevin's going to talk about upstream issues impacting energy and health needs. I want to talk about solutions. What we know about the health benefits of actually providing fuel assistance or energy efficiency. So in my 5 minutes, two things I want you to remember. One, we know from studies, and I'll point to one here by at the Boston Medical Center by Debbie Franks some years ago, pediatrics, terrific study, that if we have these are young children, 0 to 3 years of age, and when we provide fuel assistance to families with these young children, the young children have significant health benefits just by the family getting fuel assistance. They are 20% less likely to be underweight for weight and length of growth. And there's tons of research showing that if you're underweight early in your life, you have long-term health consequences. The second thing the study showed was they're significantly less likely to experience an acute hospital stay. So this study looked at two groups of kids in the Grow Clinic in multiple locations, and these are kids that were not thriving well, and half of the kids got fuel assistance and half of them did not. So the ones that got fuel, both groups ended up in the winters coming into hospitals and being sick with colds, but the group that got fuel assistance had fewer hospital stays that were multiple nights. So we know these kids were less sick, and we know that they were thriving more. So fuel assistance has, what I just would say, if go to the next slide, that fuel assistance is like giving someone a fish, but really teaching someone to fish is making sure that that building uses less energy, right? So we're not just going to pay someone's fuel bill, we're going to make that home use less energy. And so the health benefits I talked to you about fuel assistance, which is paying less for fuel, we think we'll see also in energy efficiency. But in two studies I was involved with, one with the Department of Energy called RX for Home Performance, a prescription for home performance, and this one from E for the Future Occupant Health Benefits of Energy, Residential Energy Efficiency. We looked at over 40 studies, and we're able to show that after living in a home that receives energy efficiency, we see health improvements for occupants. And I will say the vast majority of these were done in low-income households. I think actually it's a little more of a research gap on the market rate. But for what we're talking about today, this is really a bullseye. These are the studies that were of the populations we're concerned about. So we saw reduced allergies, generally less asthma symptoms and less medication use, although there's one study that had mixed results, fewer colds, fewer sinus infections, fewer throat irritation, less wheezing, and you can see the other ones, fewer headaches, hypertension, which is definitely, and Kevin can speak to this, a diagnosis we see particularly in communities of color, and overall improvements in mental health and physical health. And I also just want to call it the mental health piece of this. When we look at health outcomes, we tend to focus on the physical health, but there was a 48% improvement in a big national evaluation of number of days that people felt that they had had a bad day or a stressful day. And those mental health feeling so under pressure and that sort of toxic stress of living in a home that doesn't feel comfortable with a huge bill really permeates into other physical health attributes. When the studies looked at not just changes in symptoms, but changes in urgent care use or hospitalizations, saw reductions in asthma and other respiratory related hospitalizations and urgent care use. And for studies that tracked indoor environmental conditions, which we know are very linked to these health conditions, we saw less moisture condensation, which is kind of in the category moisture, volatile organic compounds, some mixed results on radon. And although I've been involved with two subsequent studies where we're showing no change in radon, so we're not making radon any worse, and some mixed results in formaldehyde. So my bottom line is reducing people's fuel bills in low-income households really helps improve the health outcomes of children. And secondly, funding energy efficiency, not just paying bills, but physically changing the structure, has health benefits for occupants. I'm just at my 5 minutes. I will hand it over to my good friend and colleague, Kevin.
Fantastic. Thank you so much, Ellen. And Kevin, you're up next.
So, yes. Thank you. I'm here to talk a little bit different perspective, but I think Angela and Ellen did a nice job of covering sort of the overall community impact of the things you hear, and then hearing from Ellen about the close relationship between energy efficiency work and its health benefits. But the perspective from the health system is that the traditional health system that you can see in the lower left of this slide is that people come to a clinic and the people in the clinic respond to whatever symptoms or conditions or complaints that they present. And that is the traditional role that healthcare has taken, and it really needs to move outside of that role if it's going to make a difference in healthcare in our society. That has resulted in a healthcare system that is one of the most costly in the world, and it's not targeting health dollars in an effective way. It is reacting, not being proactive. The truth is that according to the National Council on Aging, 80% of older adults, 80% of the people listening today have a chronic health condition, at least one, and an amazing 77% have two. So the large majority of older adults have a significant health problem that they're trying to manage, and children have epidemic health conditions in diabetes and asthma across the nation. It is epidemic level for these chronic health conditions in kids. And 75% of the money our nation spends on healthcare goes towards these chronic diseases, but less than 1% of healthcare dollars are spent on public health efforts. Less than 1%. It is a big disconnect in our system that is not true in other parts of the world. So the concept of upstream health is to focus on the root causes of these health problems. What can we, when we look upstream, what do we see? Where do we look? We look in people's homes. We look in their neighborhood, because people don't experience their health problems at the hospital or clinic. They experience their health issues in a home, in their neighborhood. That's where they manage their health condition. And if that home has who knows what kind of indoor air quality, indoor environmental problems, extreme temperatures because of a lack of retrofits or energy efficiency work, weatherization. Ellen pointed to some of the studies. There are other studies from all over the world that clearly show a strong relationship between uncontrolled temperature extremes and a host of chronic health problems, not counting the environmental exposures that come from that poorly managed, poorly maintained house, where the truth is, because of health inequities, because of historic environmental injustice, people in communities of color don't have access to resources to be able to invest in their home. They don't have access to enough good paying jobs and to enough resources to improve their community. Next slide. So the approach for an upstream health strategy is for the health system to connect with community organizations, to work together to solve problems by working with those community organizations who are the experts in managing housing issues, managing social service issues, managing issues within the community, and connecting what we know about the health population. And many of these health systems are very good with their data and understanding what part of the community they see certain high-risk health conditions coming from, but they need to connect those families to the resources in the community. They need to connect with and fund community-based specialists and partnerships with community-based people, where you have a health educator or coordinator who's working with a housing partner, working with a weatherization partner. There are examples of these programs across the country, and some of the speakers you may have heard from today or will hear from today represent some of those programs, as do we at Children's Mercy. The goal has to be to make for better quality care at a lower cost, is to focus on upstream, to use community data to target resources. A couple of examples of maps I've shown you are data we've looked at in Kansas City, so we can target specific parts of the community and know where the high-risk health conditions are, the high-risk housing and environment and neighborhood conditions are. And the overlap is clear, but we can drill down to the individual neighborhood level and see where dollars should be focused, programs should be focusing their collaborative efforts. So the goal of the health systems has to be to connect with housing and energy efficiency and weatherization programs in every community. And there's an opportunity there to cross that chasm, and it's currently a chasm in most communities. There's a disconnect, and many of us, those of us on the panel, are champions for making that connection between the health system and housing organizations and other community organizations. And our United Way, for example, in Kansas City, is one of the organizations helping us lead the way in making those connections to organizations. We are implementing a program called One Touch that Ellen is the originator of, that we will use to connect us with those organizations directly and them with us. So to create a network, a safety net, if you will, that provides the resources that people need. So I'll stop there. Thank you.
Fantastic. Thank you all so much for your comments and your insight. Just reminding all the audience to drop questions into the Q&A, but we'll start with a question that I'm very curious about. As we've all discussed, communities with high energy burden often tend to be low-income communities, communities of color, renters, et cetera. How can energy efficiency programs distribute equitable costs and provide equitable benefits to those communities where they have the greatest impact? Kevin, why don't we start with you?
Well, first, fundamentally, there are two things I would advocate for. One is you have to understand the community, and there is robust data out there that can help you understand any inequities in the community. And if you haven't seen it, one example I would recommend is the Child Opportunity Index. You can look that up. It is an interactive web map that you can break down by demographics that shows you by census tract what the opportunity for children are of different race and ethnicity. And that is an index of all of the different types of opportunities, whether it's education, housing, neighborhood, et cetera. And there are tremendous inequities. That's the first. The second is to invite the community, involve the community. Too many academics, too many programs come into communities to tell the community what they think they should be doing or to offer to them a bold plan or vision without asking the community. And there is no question from surveys, and I have to say I'm guilty of being involved in some of those studies in the Kansas City area, and we've learned here in the last several years that you have to engage the community in a systematic way to understand what their needs and priorities are. Because if you're not addressing what the community feels are the primary concerns, it is harder to engage them in the other efforts that you're trying to do to support the community. It has to be a partnership. You have to involve them in all of the decision making and how to invest in improving the community.
Absolutely. Thank you. Ellen, anything to add?
She's muted.
You're still muted, Ellen.
I would hardly endorse Kevin's point on engagement. Let me just make two thematic comments. One is just on engagement. I agree. If energy programs in particular want to figure out how to lead to more equitable outcomes, you have to work with community-based organizations on the ground. And as someone doing some of that work in outreach with energy programs, one of the things we're getting some good traction with is actually partnering with our health partners, so that when we go, we're particularly doing it around asthmatic patients, COPD patients, We're also looking at it, homes being dealt with for lead poisoning. So every single one of those jobs is potentially connected to the services, frankly, that they're all darn entitled to. As ratepayers, they're all entitled to these services, and they're disproportionately not getting them. The utilities that I've been doing some work with in Connecticut were not reaching certain of their ratepayers, and it was in connecting through their health partners that we're able to do that. So one is on engagement. My second point is more programmatic. I think we need more programs for renters. I think it's super easy to deliver programs for homeowners. They still have issues with deferrals and stuff, which we can talk about, but I think having some laser focus on programs for renters, because when we work through health partners, a lot of the patients we're seeing and people who are struggling are not homeowners, they're renters. And the second thing is, I think you got to think really bold. I would encourage everyone to look, it sounds like Riley's from Oregon. I really like the Portland Clean Energy Fund initiative. It was a multi-year campaign to fund significant job training, renewable energy efficiency programs to get any of that money, which is funded on a small fee on business gross revenues. You must involve a community-based organization. You can't apply for the money. It's like baked into it. And in year one, it's going to fund 8.6 million and be 40 million the next year. It's big money. And I think the community was a really community-led effort, and they have written up their campaign and how they did it in a fantastic way.
Thank you so much. And I really want to emphasize your point on renters, specifically looking back to the history of redlining, knowing that renters often tend to be people of color as well because of that history. So there is intersectionality there as well. Angie, anything to add?
I don't have anything to add. I think Kevin and Ellen really covered it thoroughly there. Thank you.
Great. Well, we'll start off with a question from the audience specific to you, Angie, actually. How can weekend and off business hours assistance be gained?
Is that the question for 201 specifically?
I believe so.
Okay, it's specific to 201. We are open 24 hours a day, 7 days a week. And so if you call us, while others may be sleeping, you can call us. And also, the secret is that when we do shut down our operations in Rhode Island offsite, we actually brought it to our call center partner in Maine, and they have access to the same database. We have 4,000 nonprofit partners in our database and 11,000 resources. And so it's more common for you to ask us what we don't have in the database than we do have in the database. And so I encourage anybody, start with 201 first, call us and ask us. We've increased the volume of our work, as I mentioned earlier, in terms of our calls over the past 6 months. And so chances, and I think the really good intersection over the past couple of months has been the work that we've been doing with housing, and being able to connect housing and energy assistance and being able to provide support to families. And so give us a call anytime, any day. Right now in the middle of COVID, we're working remotely, but we are still answering the phone.
Excellent. Thank you so much, Angie. We have a question from Gregory King. Joseph G. Allen from the Harvard School of Public Health cites the fact that upwards of 90% of public schools in America do not meet minimum ventilation standards. What tactics are schools taking to address energy improvements, improved ventilation? Ellen, why don't we start with you?
Yeah, the first thing that comes to mind is, Joe said that before we had COVID. And now we are laser focused on ventilation issues in schools and sort of doing our best to sort of get more air changes. I think there is a big opportunity to connect this with energy efficiency. I'll point to Maine. Vermont is a terrific example. Their legislature passed during COVID a $6.7 million, which is Vermont, a fair amount of money, to fund schools to do ventilation upgrades concomitant with energy upgrades. Like if we're going to touch these systems, and we're going to resize them and put in new ones, we should do it with energy efficiency. There's really good guidance for this from EPA that's on healthy indoor environment improvements during school upgrades, school energy upgrades that I would encourage programmatic. So I think this is something that the government needs to fund. This is not something that the private sector does. This is the role we're educating our children in buildings, and we have to make it so that they don't get sick, and we have to give them the environment that makes them most likely to thrive and succeed in school. And there are also great studies on green schools producing better test scores and cognitive improvements. So there's a body of research on this. So I think this is a place where states have to step in and maybe COVID is giving us that moment because we're pretty focused on schools, and now everybody says the word ventilation, not just people who are geeked out reading ASHRAE guidance.
So actually, we work in schools. Our environmental health program works in homeschools childcare. So we actually work with several of our local school districts. We are actually consultants to the local school districts. And our hospital this summer did a regional COVID webinar specifically for school districts to look at what the potential concerns and needs were and to give them facts versus some of the myths, but also to specifically make guidance and recommendation for managing your facilities now as you look for modifying ventilation systems or changing indoor air conditions in specific classrooms. There's mitigation to do, and then there's long-term investment to do. Both are needed. We are fortunate that the districts we work with partly hire us to do comprehensive audits of their buildings, and we look closely at the adequacy of ventilation in various classrooms. And no question, there can be a significant risk because many of these systems used in classrooms are not whole building systems. They are individual classroom systems, and they're erratic in their performance and maintenance. And it is true that we know what to do, but it's not true that districts necessarily know what to do or have the financial capacity, or that districts recognize that they may have a ventilation issue. They haven't, I don't mean to criticize them as a group, but there's a significant portion of facility managers for schools who are very knowledgeable and who do pay attention to guidance. And there's another group that don't, frankly, and we have seen both. The other challenge that they're getting right now is there are a large number of manufacturers of questionable technology who are barraging school facility managers with this new technology they make claims about that there isn't adequate research evidence to support. And it's a struggle for these school facility managers to try to figure out if they should invest in a certain technology or not. Fortunately, ASHRAE has, Ellen mentioned ASHRAE, has put out some really good guidance. And she also mentioned EPA, and they had an excellent webinar in the last month. You should go look for that webinar by Mark Hernandez and Richard Shaughnessy and a couple other folks to specifically walk through what guidance would be recommended for schools under the current crisis that's going on. But that's also a good best practice for indoor environmental management in those buildings as well.
Thank you so much. This next question is also directed to you, Kevin. Can you describe some of the indicators you're using in Kansas City to understand what the high-risk housing is? What beyond age of housing stock and neighborhood demographics are you looking at?
Well, that's a great question. So we are unique in Kansas City, for the most part, in that over the last 20 years, there has been a housing condition survey, a windshield survey, where we have assessed housing using a 7 characteristics, each on a 5-point scale. And that has been developed into maps where we can look at housing conditions. And we've been doing some research on the address level to look at that housing condition as it associates with certain environmental or health conditions. And that has allowed us then on a block or neighborhood level to really identify where there are areas of poor housing based on these risk factors. But then if you overlay some of the chronic health conditions like asthma, acute care visits, or positive lead tests, you see very easily patterns in the relationship. And you mentioned redlining. Sadly, Kansas City is the home of redlining. It was started here in the early 1900s by J.C. Nichols and became part of deeds for real estate coming out from here, sadly. And we still have areas of historic segregation, historic inequities in environmental justice and in just basic neighborhood quality. So that poverty overlaps, all these things through our mapping show there's this clear overlap of pollution sources and other things. So we're using this low-cost housing condition survey to quickly identify high-risk homes, and we're still building what the predictive models are for how to identify those areas. But there are basic things that you can look at about housing from the outside to get that is predictive of inside conditions that one can look at, and that is being researched in some other parts of the community, primarily through the National Neighborhood Indicators Project, which is a nationwide organization of various organizations in different cities that map various community risk factors.
Excellent. Thank you so much. This next question is to Ellen, and of course, our other panelists should feel free to jump in if they have thoughts. Can you please speak on the specific benefits of energy efficiency related to extreme heat health impacts? The understanding is that much of the literature is much more focused on winter-related impacts.
Oh man, I'm so glad for this question. Kevin probably knows this. I'm like completely obsessed with heat right now. And I think I'm going to take this back to, so there's way more people die of heat than cold in the United States, right? The heat wave in Chicago, 700 people died, 2,000 people died. In the European heat wave, we're seeing more and more of this. So that is 100% clear. It's super interesting because what's happening with climate change is we're not having as cooling off at night in Rhode Island, right? We get hot, but we used to cool off at night. The breeze would come through from the ocean, and that would help. But and there's been great research done actually in Rhode Island by Greg Willianis. I have an appointment at Brown. Greg used to be at Brown. He's now at BU, looking at heat temperatures. And if you get daytime temperatures above 85 or night times above 75 when people are trying to sleep, you see long-term impacts on chronic illness. So I think this person has it really right on point. I want to make 2 points. One is I'm very, very thankful to be involved in an initiative we started in Rhode Island this summer called Cool It Off Rhode Island, pivoted during COVID to I'm doing work with the Rhode Island Alliance for Healthy Housing, and we came up with this project. We're targeting our high-risk asthmatic kids, and we are providing them actually AC units to cool them off, and working with the Providence Housing Authority, Angela, you'll be happy to hear, and with one neighborhood in Onlyville, which is, I think, kind of where you're at, to work with some of the CDC, Community Development Corporation properties and other properties. So we're hoping that's something that we can take to scale next year, and we've gotten some contributions from the health system and also from the state asthma program. And we think that's super important, but AC units are not the way to go. Riley mentioned this earlier, electrification is the play here, and we should be incentivizing installation of heat pumps, which give you heating and cooling. And I will just flag a policy issue of concern to me in Rhode Island is, as part of your guys' sorry to be nerdy here, but some of you are energy professionals, I know, as part of the 3-year plan, you promoted electrification, but, and I think Mark might be able to speak to this later, some of the concern in promoting electrification and use of heat pumps is that it would actually use more energy in the summer, right? Because now we're going to use these things in the summer. And if we're trying to reduce energy use, we're actually increasing energy use. But that shouldn't be the goal. It should be reducing carbon and greenhouse gas emissions and creating healthier environments. So there are many health benefits to electrification, and I think that's something we should be promoting. And the questioner is 100% right. We should be deeply concerned about the increased extreme heat. You're muted, Kevin.
You're still muted.
Kevin's just going to say, I agree with everything Ellen said. She's so smart.
She's right. She's exactly right. It is population health data related to heat extremes and cold extremes, and no question there is a strong relationship, and it's an important problem. It's also been researched pretty heavily in other parts of the country, and there's a Cochrane review of health and housing impacts that shows that there's a lot of data related to temperature extremes and health issues. But the real important point I wanted to make was that as people invest in the energy efficiency of their home, that is going to be the primary response of a citizen to climate change. That is the thing they can do, is to make their home more resilient, more durable, and therefore reduce the potential for exposure to heat extremes. So that would be a primary reason for people to invest in energy efficiency work, and for states and locales to invest in weatherization and energy efficiency.
Excellent. Thank you all so much. We have about 5 minutes left. And with that 5 minutes, I want to ask a action-driven question. For for the audience, any question that wasn't answered live, we'll be sending these questions to our panelists, and we'll have responses sometime soon. But I want to ask, and Angie, we'll start with you. What, in your opinion, is the #1 action we should take to ensure that wealth and race do not negatively impact individual and community health?
The #1 impact I think we have to deal with systemic racism, right? We talked a little about redlining and how it impacts all areas of our lives. It impacts education. It's impacting where we live and the opportunities we have and our health outcomes. And so I think we can focus on the work that we're doing in energy efficiency and its impact on lower income communities and communities of color. But I think there's a larger picture that we have to really address here, which is dismantling systemic racism.
Thank you so much. Kevin, we'll go to you.
I agree. And I think it's policies. I think we have to put policies in place that can have an impact community-wide, statewide, nationwide. And it starts with honest conversations, and it starts with policy. And if you can put the policies in place, that will drive the innovation, that will drive the investment. And part of it has to be a reinvestment, but there have to be policies, equity in all policies, health in all policies. That's what my advocacy would be for.
Thank you. And Ellen.
You know, I prepared for your questions, and this was the answer I wrote for this question. Angela, I think you're right on. I mean, this isn't little tweaks, right? These are big pulling of levers. And I think we have to hold ourselves accountable and start to evaluate what we're doing and the impacts around racial lines. I mean, for example, this is narrow, but I think they're big things, but just an example. In a recent studies, I do some work with hospitals in New York State, and they're looking at COVID responses, and patients of color, even though there's a very clear guidance on what you should be doing, patients of color get poor treatment. It's actually, they get the standard of care sometimes. It's just the white patients get a better standard of care than what's actually being recorded. It's differential, and that's not okay. But you can't see that unless you collect the data this way. So, you know, for example, on energy, just to shine a light on energy efficiency programs, for example, we track how well we're doing in low-income households, the market rate households, low-income and multifamily. That's like the 4 quadrants, right? But do we ask ourselves within the low-income space, how are we doing along racial lines? I don't know that we do. What are the barriers for people accessing programs? And the other big thing that I think we're talking about, I mean, I think it's structural racism, but I think we're also talking about social determinants of health. And those are words that were unfamiliar to many people, and we're talking about that. So we have to really understand, if we're talking about health, that we have to address those real upstream things. But it's not sort of one-on-one person stuff. It's these policy and structural racism things. So, but let's be honest, let's collect data that shines a light on this so that we cannot ignore it.
Absolutely. Thank you all so much for your answers, for how candid you are. This panel was really fantastic. I definitely learned a lot. So I want to thank you so much for spending your afternoon here with us. Now I would like to hand it over to Roberta Fagan for the next panel. Thank you, everybody.
Good afternoon, everyone, and thank you again for joining us today. My name again is Roberta Fagan, Executive Director of Energy Marketers Association of Rhode Island, representing the delivered fuels and service industry sector. I'll be moderating the second panel today, Opportunities for Improvement, Models and Solutions for the Future. Our first panelist is Mark Kravitz, Executive Director of Habitat for Humanity, Rhode Island of Providence, Rhode Island. And our second panelist is Christopher Cole, Program Director for New York State Energy Research and Development Authority in Loveland, New York. And finally, our third panelist is Ruth Ann Norton, CEO of Green and Healthy Homes Initiative of Baltimore, Maryland. Thank you all for joining what has been already a terrific public event. And I now we'll ask you all to sit back, learn, and envision what that roadmap may look like for Rhode Island to achieve equitable health outcomes through energy efficiency from these three great industry experts. The stage is yours, Mark.
You can jump to the next slide. It's so great to be here with you. For those of you who might be confused as to whether or not it is the same Mark Kravitz who was a consultant with the Energy Efficiency Resource Management Council. It is the same Mark Kravitz, and it's great to be in the direct service arena working with families directly as the new Executive Director of Habitat for Humanity. So thank you for having me today. Really appreciate it. What I want to do is just sort of cover the general home repair landscape of Rhode Island for those of you who might not be familiar with the resources that are available to families. In particular, I'm going to focus on the low-income demographic of Rhode Islanders. And in my next slide, we'll cover workforce as well. But we want to provide a general landscape, and then I want to talk about some of the opportunities or challenges that we see, that I'm seeing within that landscape as a practitioner. So from a policy perspective, I do want to make you all aware that there are groups who are working on these issues in the state of Rhode Island very actively, including the Rhode Island Alliance for Healthy Homes. I think Ellen mentioned them before. Ellen's been working with them for some time now, and they're doing some good work. And that's out of Roger Williams University. Housing Works Rhode Island, also out of Roger Williams University, is really sort of our data hub for affordable housing development. And if you need statistics and data, that's where you go. Housing Network of Rhode Island supports all the community development corporations, and then obviously the Energy Efficiency Resource Management Council driving energy efficiency policy. I break up home repairs into four primary areas. That includes critical home repairs. And within municipalities, many have access to federal funding called Community Development Block Grant funding. And that funding will help, primarily through a loan program, low interest loan program, will help families do those upgrades that are needed, that are critical. When I talk about critical, I'm talking about roofing and structural, knob and tube wiring, asbestos remediation, et cetera, some of the bigger, more expensive, challenging issues. There's also the Capital Good Fund, which is a microfinancing entity that's providing up to $2,000 in funding support for critical home repair emergencies. The Providence Revolving Fund, for those who live in Providence, supports for upgrades. USDA has a Rural Development Fund, and Habitat for Humanity, believe it or not, has a focus on critical home repairs, and we work with families on a case-by-case basis based on what's going on, and that includes all of the Habitat for Humanities in Rhode Island. On the energy efficiency front, we have Rise Engineering, who's providing support on the market rate programs, and then we have the community action agencies, which are delivering all the income-eligible energy efficiency programs. And that's for families that are at 60% state median income or less. The third area is in health and safety. The Department of Health, primarily focusing on Pawtucket and Central Falls, has the Breathe Easy at Home program that's working with families to do assessments on their homes, providing them resources to manage and control asthma. And then there is the lead programs at Rhode Island Housing, which serves all of Rhode Island except for Providence, because Providence has its own lead program that serves families there. And then on general home repairs, Habitat has a sort of general upkeep and support, handrails, wheelchair ramps, general beautification, landscaping. There are resources there to support families who are at 30 to 60% state median income. From my perspective, some of the challenges or opportunities, depends how you see it. The concerns I have on the home repair side in Rhode Island is the fact that we will have a number of families who are forced to be, who will be working, at home or doing school at home this winter time. And oftentimes many of those kids are going to school to warm up. And I'm really concerned about those families who are not going to have the resources to update their homes to keep them warm, especially as they will be working at home. The reason I bring that up is because within the Energy Efficiency Program, it has been mentioned in previous Energy Efficiency Resource Management Council meetings that there's a large deferral rate for households that apply for the Energy Efficiency Program. But because of those critical home repairs, roofing, knob and tube wiring, asbestos, et cetera, they're not able to essentially participate in the Energy Efficiency Program because those are barriers to participate. Some have the resources to make those changes. Many families, especially those in our low-income program, do not have the resources. That 45% represents the market rate. I think we could assume that the rate is even higher on the low-income side. So those are two critical issues that we need to be addressing. The last, I'll just go quickly, if you can go to the next slide, is on the workforce development side. E for the Future came out with a report recently. This market saw a 14% decrease in jobs in energy efficiency in August of 2020. National Grid also, in the August EERMC meeting, recognized that energy efficiency has an aging workforce, fewer new entrants into the market, and there's a major loss in the workforce. So there's a need to update that workforce. I will say that there are a number of resources in Rhode Island relating to general building construction, construction management. A couple I do want to highlight is, and I'm excited to announce that we will be launching in the next couple of weeks a comprehensive health, safety, energy efficiency inspector training program in partnership with the Building Performance Institute. More to come on that. I'd love to share that information as it comes out, but it will be offering 11 federal, state, and industry recognized certifications because currently there is no BPI testing center in the state of Rhode Island. There is no really infrastructure to introduce new individuals who might be interested in doing work in energy efficiency and or health and safety, other types of inspections in Rhode Island that is available right now. So we're excited to fill that gap. And so more to come on that. But there are resources that are out there. I do encourage you to check out the Department of Health for their health and safety related training certifications as well. So I'll pause there and thank you for the opportunity to share a little bit more about what's happening on the ground in Rhode Island. Thanks.
Hi, good afternoon, everyone. This is Chris Cole from the New York State Energy Research and Development Authority. Thanks again for inviting me to participate today. This has so far been a really great set of conversations, and I'm looking forward to the rest of the day. At NYSERDA, I'm responsible for the energy affordability and equity work that's happening within NYSERDA and across the state. And one of the things I wanted to do today was to present, a policy framework for how, we in New York are thinking about, ways to address equity with respect to the clean energy economy, right? So we're thinking about not just, economic development in the form of jobs, created, but also, wealth development. So how can we kind of ensure that, when communities and residents are kind of participating in the clean energy economy, whether it's participating in programs or, kind of working kind of in this space, we're talking about, helping kind of improve affordability, improve housing, the health benefits. So really the full kind of suite of benefits that come from a clean energy economy. And so the primary vehicle that we're kind of tackling this through kind of in New York right now is called the Community Leadership in Climate Protection Act. I'm not sure how much those of you who have followed kind of what's happening in New York are familiar with the CLCPA. But essentially, this is kind of, the primary vehicle for addressing the energy and environmental kind of challenges that, we have in the state. And it sets some pretty aggressive greenhouse gas emissions reduction goals. So we're looking at reducing our greenhouse gas emissions over the 1990 levels by 85% by the year 2050. We have very strong electrification goals. So we're looking at not only kind of a path to carbon neutrality across the economy. I think Riley mentioned earlier that NBI is working with NYSERDA now on our carbon neutral buildings roadmap. But we're also looking at how, we start to transition the electricity generation, to more carbon neutral forms. So looking at 100% zero carbon by 2040. The most kind of interesting and exciting kind of aspect of the CLCPA, though, is a focus on equity. So I'll talk about this in a little bit, but there's requirements that are starting to direct state investments to benefit disadvantaged communities. And there's a whole process that we're currently going through that I'll talk about in a moment. But as we're thinking about kind of equity, it's not just kind of the ability for households and communities to benefit and participate in programs, right? It's also participation in process and decision making. So we're looking at kind of rolling out an equitable stakeholder engagement strategy right now to launch in 2021, which will kind of include, more regular opportunities to engage with state agencies and policymakers with lines of accountability and transparency in decisions. So, documenting feedback that's received from stakeholders and providing kind of responses to those. We're also undertaking co-design of initiatives. So really working with community organizations to help identify what works in a given community. So rather than us being prescriptive in developing a program and applying it kind of in a cookie cutter fashion across New York State, which many of you know is quite diverse, we need to do a better job of designing programs that work kind of, in each community. Capacity development at the local level is really important to kind of help us do that. So historically, we've worked with community-based organizations to do outreach and education, and it's really been limited to that. And so we started some co-design work around, community-based engagement with a number of organizations in the state earlier this year, and we wound up in a place where we've identified that, we need to provide more longer-term funding commitments for this work. We need to provide technical resources to community-based organizations and more flexible funding. So we're going to be rolling out a new initiative Q2 of next year that will be, supporting community-based organizations to work with NYSERDA to help increase awareness and education within communities, but then also, connect residents to program opportunities, and then also serve as a voice for communities. So, we'll be funding focus group activities and other opportunities for communities to bring their voice to decision making at the state level. The other thing I'll flag real quick here, because I want to be conscious of time, is within the CLCPA, there is kind of a directive to, do more for disadvantaged communities and underserved communities. In parallel, in the clean energy side, we are, kind of launching some pretty large initiatives now. The state just recently announced an $880 million investment through 2025 to increase access to energy efficiency programming for low and moderate income households. So that's something NYSERDA, in coordination with the investor-owned utilities in the state, are administering. And then similarly, we've announced a $175 million investment to create workforce development opportunities for priority populations. So, underserved, unemployed, previously incarcerated, folks that need some upskilling. So we'll be kind of targeting opportunities for apprenticeships, on-the-job training, so on and so forth. And those are two of the more tangible investments and program opportunities that we're rolling out right now. And if you go to the next slide, please. And so, where this is ultimately going to go is, we're going to build on those kind of more concrete investments and look to direct more of the state's investments to benefit disadvantaged communities. So the CLCPA requires that at least 35% of state investments in the areas of energy efficiency and clean energy across the housing, social service, energy, transportation portfolios in the state need to benefit disadvantaged communities. So there's a whole kind of process that is being kind of worked on right now, kind of within the state, to define a disadvantaged community. So the law provides, 3 kind of categories of indicators that need to be included. But essentially, there's a climate justice working group, which is composed of 9 community-based organizations and 4 state agencies who are working on developing the criteria for a disadvantaged community. And then in parallel, we'll be working on developing kind of the benefits framework. So what is a benefit, right? So everything from, direct financial, benefits to positive health outcomes, to workforce development and other economic development opportunities are all on the table here. And so, over the next year, we expect that we'll have a final definition of what a disadvantaged community is. And then kind of in parallel, kind of shortly after, we should have kind of this benefits framework and accounting wrapped up. So it's really an exciting time in New York, as, we're starting to see kind of, equity kind of become more of a requirement, right, in policy. And when you're talking about a state the size of New York, with the budgets that New York State, has in the public sector, 35 to 40% of investments is a sizable number. So, so it's a great starting point, and yeah, we're looking forward to advancing this work in the state, but obviously also happy to kind of work with colleagues in other states, to kind of dig in more here if there's any relevance for you. Yeah, so let me stop there. So I think I'm over.
We have Ruth Ann Norton. Ruth, your microphone is muted.
Can you hear me now?
Yes, ma'am.
There you go. Great presentation, Chris, and thank you for having me today. I represent the Green and Healthy Homes Initiative, and we are very proud that we're celebrating this year our 10th year in Rhode Island, where we direct the Attorney General's Fund on Healthy Housing, and working with Rhode Island Housing, the City of Providence, and 23 jurisdictions across the state, and also our partnerships with Integra and the Rhode Island Builders Association, where we're advancing work to perform work on virtual platforms and advance the work of Black and Brown communities and training Hispanic contractors. I wanted to talk to you today about ways that we are looking at funding and solutions in this work, but I could not miss the moment to say thank you for raising the issue of equity. It's the issue that was our grounding factor when we started the work of GHHI over 27 years ago, to ensure that communities of color, especially the African American community, when we started first here in Baltimore, that we were creating housing that was healthy and safe and energy efficient, so that every child could get to the classroom healthy and ready to learn, and every parent could get to the job without having the issues of turnover and stress and caring for sick children because of their home. So I wanted to talk to you about what we are doing around funding, but I also do want to thank NYSERDA for the work they're doing on their climate action panel, and we're very pleased to be helping that work advance. Some of the things that we are doing that aren't on the slides I want to talk about first as we think about racial equity and energy. And I think one of the models that we'd be happy to share with folks is what we're doing in Pennsylvania with the CARES Act dollars to establish metrics to measure the impact on racial and health equity for the things that you've heard about today, the work to create better indoor air quality, cooling and heating, to lower the environmental health threats, and ensure the long-term efficiency and health of units. And we're taking those dollars to look at the impact on asthma, injury, and other issues there to advance the work that we've all been doing. We worked with NYSERDA to help provide a feasibility study and program design to add health and safety to their work. Is now advanced greatly in New York to look at this from an equity measure of how do we improve the lives of the most impacted individuals. But what we have really built a practice on is linking the work that so many in the energy efficiency field are doing through Medicaid and managed care reimbursement, and through utilization of what's called value-based purchase financing. And a couple of examples of what we are doing in that work include hospital community benefit investments with the University of Pennsylvania. We've launched a $50 million hospital community benefit investment and working with hospitals around the country on this. In Baltimore, we are funded by the AmeriGroup Managed Care Organization for reimbursements on our work on air quality, energy efficiency, and health based on the outcomes of patient health. And we've been looking at other programs for expansion around how do we support energy efficiency by expanding the use of dollars that come out of the children's health insurance programs that are available to most states. They're unused administrative dollars that can be used to improve health outcomes through housing. In many places like North Carolina, where they're using their Medicaid dollars through housing opportunities and health opportunities, now are doubling down on housing as healthcare. But we look at this through this alignment work between energy and health and measuring those outcomes, and having those measures on health outcomes are critically important. But what we also know in looking at data that's not just new and being illuminated through COVID, but is long existing, is that we have to look at the actual data on what dollars come back to communities. And so I think the work that New York and Pennsylvania are doing to mandate and move forward the engagement of community organizations in this is a critical pathway and roadmap to what we're seeing. If you want to go to the next slide. So some of the cross-sector partnerships in this is we've worked with Amita Health and Elevate Energy in Illinois and Navigant to advance energy efficiency and asthma reduction. We're now working with them on other integrated programs. And the work that we helped to design with Congressman Price has now resulted in a NOFA that is out on the street right now from the U.S. Department of Housing and Urban Development that is looking to fund the leverage between weatherization, lead hazard control, and healthy housing. So many of you should be looking at that application as an opportunity. We're also looking at this statewide systems change to align at a larger systems level all of the cognizant agencies in states like Michigan, Maryland, and Connecticut, where through the Connecticut Green Bank, we are advancing work that aligns Medicaid dollars, housing dollars, and energy dollars. Our own Public Service Commission in Maryland put in $38 million into the work of green and healthy homes as a measure of healthcare. And in New Jersey, they're looking at the whole house pilot, which is advancing the work that money would flow together. So it's looking at all of the things that you've seen here today to have put into real practice. And so I look forward to talking about the cross-sector partnerships that are needed for that build from ground up, and that in the end really are measurable around racial and health equity. Let me stop there and let's get to the dialogue.
Thank you, Ruth Ann, and to Kristen and Mark as well. We have a few questions that have come in, and while those are loading, I have a question. How might we scale up some of the examples of your work you shared today to increase the impact of pilot programs? And that's for any of our three panelists.
Yeah, so I can jump in. So I would say, the focus on scaling up would be in leveraging resources for those critical home repairs, because I think once you can take care of those issues, it opens up and accesses a number of other programs that unfortunately cannot contribute their resources unless those issues are taken care of. So scaling up, I think, happens when we take care of that critical issue of critical home repairs or pre-weatherization issues, as is known in the energy efficiency side.
Yeah, I think this
Mark, excuse me, go ahead.
Now that we're just beyond the time frame of small pilots to be, if we are serious about addressing racial equity and really community engagement, I think there's a huge recognition of scale. And I think we have seen what can happen quickly out of philanthropy, out of government, when we need to act around COVID. Not talking about the COVID federal health policies, but about the ability to move programs quickly. The evidence is in on this, and we have to now find the ways and mechanisms to get to the hardest problems and lift, and this has to be done at scale, or we will be talking about this another generation down the road.
And Mark, any thoughts on how we might scale up to get more impact from the pilot programs that you talked about today?
Was that for Chris? So I think Mark
I'm sorry. Just in general, just how do you see that we can scale up some of the work that's happening here in Rhode Island?
So this is Chris, and I guess I could jump in. I didn't share earlier. I mean, I think when we're thinking about pilots or any investments, we're really looking at like what how can we scale? As Ruth Ann said, I think the challenge here is we have such large disparities in how resources are allocated. There's such large populations that are kind of in that underserved category that we need to look at kind of all options. So whether it's kind of the coordination of resources, like Mark said, Ruth Ann mentioned value-based payment financing. Like, is there a way to bring kind of third-party capital and resources into these sorts of programs? And that's one of the things at NYSERDA in New York, we we're looking at in a number of areas to help kind of ensure that we're able to kind of build on kind of like the public and ratepayer funding that's being invested, just given that they're finite resources. So it's really a matter of like how to develop this kind of model for third party capital investment, and that's not easy, right?
Mm-hmm. So I think the scale is happening, though, right? Beyond the New York significant investment in Michigan, we're building with the Department of Health a $1 billion fund to invest in healthy housing, to eradicate lead, to make houses more safe and energy efficient. The states are now thinking at large scale. And so when we're looking at how do we bring in private sector in the Bronx, we're using private sector upfront support to pay for outcomes on the back end, utilizing current Medicaid programs and value-based purchasing. But we have 10 Medicaid reimbursement contracts around the country that are actively working and looking at things like indoor air quality, extreme heat, extreme cold. And this expands beyond just looking at asthma, but looking at how this impacts cardiac health for seniors and where there's utilization through Medicare Advantage to do that. But I think we have 10 governors that we advise, and all 10 of them are looking at large-scale, whole-house ways of funding up to address the issues of racial equity, to address the issues of COVID, where we have asked the nation to use their housing as a shield for health, but yet we know in New Jersey and in Maryland we've seen elevations of lead levels during the period. We've seen exacerbations of asthma. And so we have to really think about how do we think at scale coming out of COVID. And I think Rhode Island is in just a tremendous position because it is a small enough state that going to scale is an achievable thing for funders to look at. And you have all the right elements and all the right players in the system. You have an incredibly fabulous health department, energy, and housing. And I think your healthcare system is actively engaged in this. And so I think scale is something that Rhode Island can and should look at in response to the current times we're in.
Roberta, you're muted.
I'll get this one of these days. Sorry about that, folks. So we had a question from an attendee. Are there any creative strategies for investing in underserved, disadvantaged communities that include funding co-ops or ownership stakes for residents, owners, and renters on local clean energy efforts? Mark, would you like to take that first?
Sure. So I think that there are some examples happening in Boston, the Boston metro area, regarding co-ops and co-owned properties that are going into together on energy projects, clean energy projects in particular. Nothing in Rhode Island that I have heard of, but I think it's something to be exploring as we look forward to, a really sort of crushed market as relates to a rental and affordable housing market that's really being stressed out. It was stressed out before COVID hit and is hitting us even more. So I think, looking at co-op models is something that needs to be assessed and see how well they're working in some of the larger cities, and see whether or not there's opportunities. I know the city of Providence is certainly looking at co-op models through the sustainability committee efforts that are happening there. So I think it would be helpful for us to explore that more.
Thank you. And Chris or Roseanne, do you have any thoughts on creative strategies?
Well, one of the things that that has happened in New York, and we're in at NYSERDA, we do have some resources that we've made available to community-based organizations to help develop a plan to develop a community-owned or community or a project that benefits the community, a clean energy project. And there's a couple of examples, and one of them that's I think most kind of useful here is we have a great partner in Buffalo, New York, Push Buffalo, who has developed a housing. It's like a small community-owned housing development with community solar kind of attached. And so what they're able to do is provide the solar to the residents of the housing development, as well as kind of use some of the proceeds to help continue to fund their operations. So that's one example. We are really interested in looking at how we can get more kind of co-ownership of distributed energy resources like community solar. And there's a similar kind of example. We have a number of manufactured home parks in New York State. And so the state housing agency has been working with some of these parks for the last couple of years to help kind of transition the ownership model from a typical kind of landlord or company kind of owning the park and renting out the lots to a co-op ownership model. And as part of that, NYSERDA has been working with the housing agency in the state, New York State Homes and Community Renewal, to run what we're calling a Park of the Future demonstration, where we're working with some of those parks to help understand how kind of the inclusion of clean energy resources, such as like district geothermal to displace on-site combustion of oil or propane or kerosene, to community solar. We don't have any projects complete yet through that demonstration. There's two that are just starting the process now, but I'm happy to share more information about that as it proceeds. Hopefully it's helpful.
Don't mind, I'd like to also, yes, I am unmuted. I'd like to also, we had another comment. Please briefly comment on ways to intersect tie in the role of decent energy public transit in the discussion regarding equity and access, particularly in terms of working poor communities who depend on buses to do business and are often frontline workers in countless sectors. Not to mention that these folks are not usually they don't usually earn living wages. If you could briefly comment on that, Ruth Ann, would you like to start?
Sure, I used to chair part of the Sustainability Commission here in Baltimore, and one of the things we looked at is you can't build healthy housing or create healthy housing on an island if people are not able to really access where they need to live or worship or engage. And so I think it's not only that we have to think about good access to transportation. It needs to be energy efficient. It needs to be advancing electrification that we are working on in housing to the community of how we provide transportation. I think it's critical. And in what is being discussed about a post-election stimulus, is this look at sort of healthier housing, healthier communities as actually being a part of that funding and being connected in this. But if we're going to make people healthier so that they can actually spend more time at work and at school, we have to make it available for them to use new age technology. And through all of the crisis that we're in here, I think the one opportunity coming out of it is the allowance to think big, the allowance to think in scale that brings us to modernize so many things. And I know transportation is at the crux of that for the viability for people to have economic mobility and wealth retention.
And Chris or Mark, would you care to comment as well?
I can comment briefly, and I think in addition to providing, reliable transportation for economic development, kind of opportunities, so similar to Ruth Ann, I mean, her points. I mean, when we're thinking about clean transportation in New York, it's a big environmental justice issue when you're thinking about some of the more congested parts of the state, especially the New York City area where, a neighborhood like Hunts Point, which has the Hunts Point terminal, which is like the largest produce market in the world, where idling trucks, fleet vehicles, become present kind of large air quality issues for residents, and we know that many low-income or Black and brown families are living in that neighborhood. So we have a kind of a need to make sure that we're investing in transitioning these vehicles to more electrified versions, and one of the challenges that we're seeing in New York State right now is just given the fact that the state is pretty diverse. We have very rural parts and more congested parts. So transportation strategies that work in New York City to electrify fleet vehicles or buses might not be kind of as applicable to the North Country of New York State, where bus routes are less frequent and people are relying on traditional diesel-powered trucks and buses to get around. So it is presenting a challenge for us in New York to think about how to do this across the board.
Yeah, Roberta, I'll just share very quickly. I think the built environment is one key thing for programs to be looking at, but I think we need to recognize that our homes are within a larger community environment. And so I think we should be looking at the entire properties, everything from storm waste. I see there's a question on trees, including trees, including elements relating to passive house where we can increase shade. All those elements. I think of Dr. Peter Simon, from former medical director from the state of Rhode Island, who was constantly talking about trees and recognizing their health benefits. But this also includes creating an environment that is shadier for additional bicyclists and incorporating a transportation system that allows people access to a safe pedestrian walking and biking within the city. All ties in to elements from an equity standpoint. It's tough when you can't get from the West End all the way to the East Side in the city of Providence without feeling threatened for your life in traffic. So those are key pieces in this as well.
I think we can all agree that Rhode Island definitely has a lot of room to improve, especially in public transportation. And I think we've all experienced what you have, Mark, whether it be on foot or on a bike or, you know, just crossing the street anywhere in the state of Rhode Island. So thank you for those comments. We are at 2:45. I know we have a couple of questions that we weren't able to answer, but I think that we should probably move on to the next portion of the meeting here. And I'd like to introduce Karen Varengia. Karen, are you?
I am here, yes.
There you go. Okay. Well, thank you very much again to our second group of panelists. I think we've touched upon many things today that we can continue to chat about. But without further ado, I'd like to give the stage to Karen.
Hi, my name is Karen Varengia. I hold the chair on the Council for Workforce Development. And our goal as a council is to ensure that Rhode Islanders are getting the least expensive and most environmentally healthy energy supply through energy efficiency, conservation, and resource management. We encourage all of you to participate, and you can participate by attending a council meeting. We would love to see you there. Learning a little bit more about policy, because that's really important, and giving public comment at one of our meetings, or having you submit public comment. We love to hear from you. We want to hear your thoughts, and that's how it helps us to make decisions. I want to thank everybody who was able to speak today, taking the time out of their day to join us, to give this educational component. I'd like to thank URI for helping us as a council to coordinate this effort. And most of all, I would like to thank all of you for participating, because without you today, we would not be here. So thank you, everyone. I believe that we can adjourn our session. It was a very successful one. Enjoy your day.
Thanks everyone for being here. We will be sending a follow-up email with an evaluation survey that we'd really appreciate you completing. Also the slide deck in PDF format. And we will pass along the questions, as we said before, that weren't answered to our panelists and try to follow up for you. Thanks so much for being here again. We do have another event on October 7th. You will be notified of that. It's called the Plugged into Energy Research Lecture Series. Thanks from all of us at the University of Rhode Island and the Rhode Island EERMC. Have a great day.
And thank you for organizing such an amazing event.
Thank you, Roberta. Thanks, everyone.